Hello, my name is Adappa. I'm an assistant professor here at University of Pennsylvania. I'm going to talk about keeping your nasal irrigation bottle clean. First off, this video is exclusively made for patients of mine or patients of my partner, Dr. James Plummer. If you are followed by another ENT physician or any other physicians, please touch base with them before utilizing any instructions we'll discuss today. So, regarding your NeilMed irrigation bottle, to keep this clean, the first thing is I typically have a preference to use the NeilMed Sinus rinse bottle for most of our irrigations. We may have prescribed other bottles for you, and you can use any other bottle that you'd like from an irrigation standpoint. The key points for it are they have to be high volume. So this bottle is 240 mLs, and additionally, we want some force, and we really want that irrigation getting in. So from a standpoint of keeping clean, the data has been very mixed as far as what it means keeping a bottle clean from our standpoint with bacteria. We haven't shown anything that has shown that having bacteria in a bottle affects whether you will get recurrent sinus infections, but with most of our patients who are very sensitive to sinus infections, we really want to take every precaution possible to keep our nasal irrigation bottle clean. From our standpoint, the key on keeping the bottle clean is immediately after you use it, you want to rinse the bottle out. You can use water that's either been boiled before, distilled water, or water that's been filtered at the very least at 0.2 microns, or commercially available bottled water. With the water itself, I like to heat this up so it's warm to hot, and include some dishwasher soap in there. Really shake that bottle out and really rinse this out and get it clean. In addition to this, I do prefer that you use some device to actually clean the bottle itself. Typically a baby bottle cleaner works really well for this, and this allows you to really clean the top of the bottle as well as the bottle itself. And then the other key for us is you really want this bottle to air dry. So it's not just something you want to just hang back up or screw the top back on the bottle and leave it for the next time you use it. We want to, as soon as you get it as dry as possible, just from shaking the bottle itself, you want to hang it upside down on some sort of device. I believe NeilMed has a particular device they use to keep the bottle clean. I think any device is just fine, but essentially something to keep the bottle upside down and allow that excess water to drain out and air dry. The other thing that I strongly prefer is, because you want this to air dry, if you are irrigating your nose multiple times a day, have at least 2 bottles available, so at least one bottle is getting dry for a longer period of time before you use that second bottle. Finally, if you see anything odd on the bottle itself, and take a look every time, any cracking on the bottle, dark colors, discoloration, I would change that bottle out. From a standard point, if you're doing well, the company itself, and I tend to agree, recommends changing your bottles out every 3 months. My preference personally are these disposable bottles so that you can change these out every 3 months, as opposed to some of the devices that don't require as frequent changing. The last thing is, if you do get a bad sinus infection, after you go through clearing that sinus infection, I would get new bottles. We know that bacteria contaminates back into the bottle itself, and theoretically you can be pushing these bacteria back into your nose. Hopefully these tips will help keep your sinus irrigation bottle clean. And as always, if there's any questions for me or Dr. Plummer, please don't hesitate to call our office.